Sometimes it can be difficult to obtain an accurate history from a patient with a learning disability, particularly if someone has little or no speech. Establishing a communication method beforehand will undoubtedly help, but you may find that the key source of accurate information may be from someone who knows the person well.
The importance of getting a visual or family history from patients to try and establish what problems they might have had in the past with their eyes. Sometimes this information is not so easy to obtain, but where possible it's vital. So we know if we see a problem, is that something quite new? Is that something they've had from birth? Is it something they've acquired over the last couple of years? So any information we can get is very important.
Within RNIB's Bridge to Vision service, optometrists are provided with a comprehensive history using a dedicated pre-optometry form. Following a functional assessment by the project assessment worker, information such as observed eye health, preferred testing method, and any medical or other issues are forwarded to the optometrist to help plan and prepare for the eye examination.
When you're taking a history in an optometry exam, usually you speak to the patient. I always start by speaking with them as well. Even if they don't have speech, I'll say, how are you today? We're going to look at your eyes, just because it's a nice social thing to do. And obviously if they do have speech, you develop that communication first. We're going to see your eyes. How well do you see? Simple question. And then obviously at some point in the history you're going to involve the carer. But the carer is going to fill in, when did they last get their glasses? How long have they had them? Is there a problem with them? Do they use them? Because you can't necessarily get reliable information from the patient. So it's always a three-way conversation. You need the same basic information. You need to know what people's vision is, what kind of vision problems they are, how their past care of their eyes, what their history is, and their medical conditions and their medications. But what's different? We just assume that most people have a diverse range of visual needs, and we ask specific things like, do you drive? Do you use a computer? But we don't ask, do you want to recognize friends? Or you ask lifestyle questions. Where do you stay? What kind of support do you have, or does this person have, if you're asking the carer? What activities do you like? As well as the medical background that you always ask, like diabetes and high blood pressure. I usually specifically ask people whether they have a seizure disorder or epilepsy, and inquire carefully about their medications. A lot of people are taking medications that act on the nervous system, either for seizures or for behavior modification, or for anxiety, and many of these will have side effects. It's not that necessary to know what every side effect is. Quite often it's earlier cataracts or effects on the pupils being smaller or bigger. Just to be aware that those things are going to happen. You've written down the medications. You can look them up later, but to know that that might be an issue for that particular patient. Prioritize your examination. Be flexible about the order in which you're going to go through everything, and don't expect the same level of completeness or accuracy.
However, no matter how well prepared, the key to success will be the optometrist's flexibility and a willingness to take things a little beyond their comfort zone.